Come in.
Good morning, Mr. Mayor. Your 9 a.m. appointment is here for you.
Okay, thanks. But here's the thing. I completely forgot about this meeting, so lay it out for me. What are they here for?
Well, Mr. Mayor, they're here to talk to you about the obesity epidemic in Baltimore. It's a really big problem for the city. Nearly 34% of the population is obese, well over the Maryland rate of 29%. Obesity is such a serious matter because it lowers a person's life expectancy by 9 years and can cause a whole host of health problems like diabetes, high blood pressure, coronary artery disease, and even cancer. Not only is obesity associated with serious health problems and a lower quality of life, but also with serious economic costs. In 2015, obesity was responsible for $200 billion worth of medical spending, as well as 13% of total Medicaid spending. Like with the rest of the nation, Baltimore's obesity rates vary greatly based on a person's socioeconomic status, with low-income Baltimore residents having over double the chance of being obese as those with higher incomes. The people here to see you today have some good solutions to tackle this tough problem.
Let them in.
Hello, Mr. Mayor.
Welcome to my office.
Thanks. Hi.
Pleasure to meet you.
I understand that you're here to talk to me about obesity. So what are your plans?
Combating obesity requires a healthy diet in tandem with an active lifestyle. My proposal will focus on creating accessible means for Baltimoreans to get healthy foods. My solution is to work with Greek service organizations at the various institutions of higher learning in and around Baltimore City to revitalize the community gardens scattered throughout the city. Currently, there are 2 main organizations that work on the development of these green spaces, one called City Farms and another called Adopt a Lot. Baltimore City is a college town with over 10,000 students participating in fraternity and sorority life across the city. These students take part in a variety of activities and organizations ranging from traditional Greek life all the way to service fraternities. These groups work alongside thousands of other college students working in other student service groups in and around Baltimore City. My proposal is to increase collaboration between the city and the universities to maintain these community gardens.
That's interesting. Tell me more.
One specific example of this is the Kappa Mu chapter of Alpha Phi Omega, a national service fraternity at Johns Hopkins. Throughout this past semester, the fraternity has worked on a service site called Carmine Gardens. The Johns Hopkins fraternity contacted Adopt a Lot, which put the fraternity in contact with a landscaper working on reconstruction of the Carmine Gardens. The fraternity worked with a nonprofit to completely clean the garden and prepare it for use in the spring. Encouraging this collaboration would be costless and highly effective.
Physical fitness is key to fight obesity. While there are many recreation centers and parks in Baltimore already, we're interested in making sure that there are spaces accessible to all Baltimore residents and that a wide range of amenities are being offered. The first option we have is to build new recreation centers in locations where currently there are no centers within a 1 to 2 mile radius. And there is a map of gaps in this coverage, and we've identified that Southwest Baltimore would be an ideal place for this due to the density of people there. So that would cost about $10 million per center. And according to previous proposals, we could fund this from state, city general, and bond funds, as well as casino revenues. The second option we have, if we didn't want to do that, is to upgrade existing facilities that are a little old and run down. And this would be estimated to cost about $1 million per center. And there are a lot of ways in which we could upgrade them through exercise equipment, offering a wider range of classes. We could have more community nights, but that would be another great way to revitalize the recreation centers in Baltimore. Another option we have is to provide exercise equipment, which it has already been installed with great success in parts of Baltimore, such as Druid Hill Park and Lake Montebello, and there's been a positive response there. But there are a lot of parks that could use exercise equipment and could really benefit from it, such as St. Mary's Park, which currently it's just like a patch of grass. And there are little parks like that all over Baltimore, especially in urban areas that don't really have many amenities. So installing an exercise equipment station there would be really helpful. And this would be about $50,000 for each based on current estimates from what it costs to install at Druid Hill Park and other locations. The final thing is to make sure that people know about these resources, because it has been shown that attendance rates have declined over the past couple years. So we recommend doing a social media outreach and ad campaign, as well as hosting more free events to get people to come to these community spaces, such as the Docs in the Parks program, where they have doctors at parks and people can come and ask them advice and also see what the park has to offer. And this would be a good way to draw more people to take advantage of the centers in their communities and establish it as a true community center.
Wow, I could really use some exercise in my life.
Mr. Mayor, in Baltimore's 2016 local wellness policy, it states that the Baltimore City public school system must follow the Maryland State Board of Education nutritional guidelines. Two of these guidelines are to 1, limit portion sizes to single servings, and 2, limit fat and sugar content of those foods to specific amounts. Upon examining the school lunch menu for BCPSS, we found that these guidelines are not being properly followed and that there are clear misconceptions on what defines a healthy meal. Unhealthy options are frequently offered. Some of the main entrees are extremely fatty foods like pepperoni pizza, hamburgers, and fish and chips. While all these meals are relatively balanced, the amount of fat in these meals, just one meal of the day, is concerningly close to what is needed in an entire day.
I didn't know that.
Indeed. This is why it is essential that students get healthier food at lunch and why this proposal is so important. So the specific guidelines of our proposal is that the fat served in any meal does not exceed 15 grams. This is as easy as switching a fatty beef hamburger patty to a turkey or a chicken patty, which are both lean meats. Also, part of our proposal is that schools must explain to their students why their meal plans are like this. This could be discussed at assemblies or even in health class. So the current meal plan costs the state around $43 million a year, requiring students to pay $3 per meal. The cost of our proposed meal plan would not be too much different. The projected cost would be just over $45 million a year, with students paying around $3.15 for lunch. Low-income family students would still be eligible for free and reduced lunches also. While this is more expensive than the current plan, the health of Baltimore's youth is a priority. Lunch may be the only quality meal that these students get in a day because their parents do not provide healthy meals for them at home. This meal program will aim to encourage students to be more conscious about what they eat and to carry this healthy eating mentality out of school into students' households. Through the youth, Baltimore can tackle obesity and promote healthier lifestyles.
Nice. Cool.
So you're saying that by encouraging communities to exercise more and by offering healthy, accessible foods for both residents and their children, we can lower the obesity rates in Baltimore, right?
Yes.
I will consider your proposals. Thank you for meeting with me.